This is Caring for Kids on News Talk 760 WJR. Presented by the Children's Foundation. And here's your host, President and CEO of the Children's Foundation, Larry Burns.
Thanks, Mark. Hello, everyone, and welcome to Caring for Kids. Tonight, we have another great episode featuring some very special guests who are all working hard to advance health and wellness of children, young adults, and families. Tonight, we have Kylee Mitchell-Wells, the Executive Director of the Balmer Group, Dave Ripple and Amanda Sweetman of St. Joe's Mercy Health System, and rounding out our guests will be Loretta Bush, the President and Chief Executive Officer of Authority Health. It's all coming up next right here on Caring for Kids on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
In the studio is Kylee Mitchell-Wells. Kylee, you're the Executive Director of Balmer Group's philanthropic efforts in southeastern Michigan. And prior to her role at Balmer Group, Kylee served as Senior Director for the Detroit market for the national nonprofit enterprise, Community Partners, focusing on addressing the needs of low and moderate income. Kylee also worked with the city of Detroit to assist with the largest municipal bankruptcy in U.S. history. And so, Kylee, welcome to Caring for Kids.
Thank you.
We're delighted that you're here.
Larry, I'm so glad to be here.
It's good to see you always. So your career path has been very diverse, some with some very exciting positions over the years. So tell our listeners about your background and how these experiences have really positioned you to do the work you're doing now.
Sure. Well, I am a recovering finance professional. I spent about 15 years total in the corporate sector doing the hardcore numbers and budgets of multi-million-dollar companies and internationally traded companies. And I decided really wanted to utilize those finance skills to help people, and I had no idea what that meant. So what do? You go to grad school and you figure it out. And so I went to graduate school in New York, received a master's in public administration, left there and went to D.C. And that's when I first started to work in community when I worked for a former mayor out in Washington, D.C. Mm-hmm. And I did that for about 2 years, and it was right at the height of the financial crisis here in the country. And I said, you know what, I want to go back home. Detroit is home for me, and do some good community work at home. And came back and landed my first opportunity at the United Way for Southeastern Michigan and did that for a few years. And as you noted in my bio, I worked on the bankruptcy and landed with Balmer Group about 2 years ago, this month, actually.
Wow, time flies. And so as you and I have talked about, both of our career paths have included the United Way here in our hometown of Detroit. So it's a good place to work and gain experience. And so all of these great experiences over the years, and how do you think each one, or does one stand out that has prepared you for entering this new arena?
You know, the one thing I love about Balmer Group, Larry, is that we really look at all sectors to help and support kids and families. And so my varied career path, be it in the corporate sector, government, nonprofit, all of the roles have truly prepared me to look holistically at problems in the community and to leverage the variety of stakeholders that exist in the community to help move it forward. So I think that every role has truly prepared me for where we are today with Balmer Group and how we look at helping communities through a collective impact approach, and that's utilizing every sector to really get at the type of impact that we like to see for kids and families.
Yes, and I have to believe your finance background also helps you from time to time.
Just a little bit.
Yeah, good. I wish I had that. We're talking with Kylee Mitchell-Wells, who's the Executive Director of the Balmer Group's philanthropic efforts here in Detroit and southeastern Michigan. And speaking of the Balmer Group, it's relatively new to our area, to the nonprofit scene, if you will. And can you give us a view of how this dynamic effort, and I say dynamic because I know that it's evolving and changing, how it was established from a national perspective, and now how it's helping Detroit and surrounding areas.
Sure. Well, Steve and Connie Balmer decided about 4 years ago that they wanted to use their philanthropic resources to be organized in their giving. They had been giving for a number of years, but it wasn't a real strategy around kids and families. They were doing things in the community of Seattle, and they said, you know what, let's put a real strategy together so that we can have greater impact. And so 4 years ago, Balmer Group was formed, and our initial office was located in Seattle, but then we also have an office in L.A. because of Steve and Connie's ownership of the L.A. Clippers. And the last office was opened 2 years ago with my hiring here in Detroit because Steve was born and raised here. And we look at economic mobility as the key driver to helping communities and families. We focus on education from early childhood to K-12. We focus on college and career readiness, all in service of really helping to move families forward.
Yeah, move forward and break down maybe generations of poverty in some cases.
Correct.
It's also very, very cool to hear another Detroit native go on to, in this case, world-renowned success.
Oh, thank you, Larry.
And then for Steve Balmer to want to help Detroit. I mean, and you mentioned L.A., Seattle, and Detroit. And so what great company to keep. Now, I know recently you announced your initial grants made by the Balmer Group. And so I was very impressed with that. And can you talk a little bit about those, and then maybe specifically about this these new efforts with Sinai Grace in that area of the community?
Certainly. So last November, we made our initial round of grant making, and it totaled about approximately $26 million. And those resources primarily landed in Detroit, but we are a Southeast Michigan funder. And so some of those resources landed in Oakland and Macomb counties. We focused on grass top organizations, like some of your larger ones like United Way. We also looked at grassroots organizations like your Sinai Grace Guild CDC. And we have landed on really focusing on neighborhoods. That's one of our key areas of focus here in Detroit. The Sinai Grace neighborhood, as you know, is in Northwest Detroit. Steve was actually born in that community.
Okay, that's what I was going to ask. So he was born there.
Yeah, he was born in that community. I, too, have roots in that community.
Even better.
So we said, you know, what better way to work in community than with the hospital system? They are an economic driver. We saw activity that was happening in Northwest Detroit over in the Marygrove area, and our friends at Kresge, all the great work they were doing there, the work that is happening in the Grand Mount Rosedale area. But Sinai was kind of the missing middle, and they've made significant investments in their infrastructure, and they approached us about addressing the social determinants of health.
All right.
And so we've started to work with the awesome leader over there to really look at a workforce development program to help get families into housing there, but then also to get jobs at the hospital.
Absolutely. So those are the social determinants of health that impact all of us. So having safe, good housing and having a job to be able to provide for yourself and your family impacts your health and therefore the social determinants of health. And
certainly.
And so we admire all of those things that you're doing. And again, we're talking with Kylee Mitchell-Wells, who's the executive director of the Balmer Group's philanthropic efforts in southeastern Michigan. And as you and I have come to know one another, you recently visited the Children's Foundation offices with your staff and your team. We are all about those areas and groups of people that you just mentioned. So children, early childhood, kids in grade school, kids in high school, young adults, families, really trying to be about wellness. And since we're an independent foundation now, we love hospitals, but we're really trying to keep kids and families out of the hospital by things like social determinants of health. So a loaded question, since I work for the Children's Foundation. I'm hoping that someday we might find some projects to work on together, if not directly, certainly in the same neighborhoods.
Certainly. I see so many synergies between the great work that you and your team are doing, Larry, with the Children's Foundation. And it really enjoyed our time with you learning more about the work that you're doing and all of the synergies that we have. And certainly we see an opportunity for collaboration. I believe in some instances we are investing in some of the same priorities, and we'll definitely look to do so in the future.
Wonderful. As of today, we now have 77 partners in the community, and the community is broader than it was, so it includes another several sections in Michigan. So we're delighted that we just added 7 new partners to that list, so we're up to 77. And I am sure that in the not-too-distant future, the Balmer Group hopefully will be one of those.
Of course.
So
you can count on us.
Kylee, thank you. Anything else you want our listeners to know?
Keep up the good work,
All
Larry.
right, good. I look forward to working with you and appreciate it very much. That was Kylee Mitchell-Wells of the Balmer Group. And next, we're going to hear from David Ripple and Amanda Sweetman about their work at a local healthcare system, which includes farming. Very interesting. That's when Caring for Kids continues here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Foundation.
And 2 great guests in the studio. Love when they're in the studio, rather the phone. And I'm going to tell you about them. Amanda Sweetman. Amanda is the Regional Director of Farming and Healthy Lifestyles for Trinity, Michigan. Amanda graduated from the University of Michigan in 2007 with a bachelor's in ecology and evolutionary biology, and from Utah State University in 2012 with a master's in wetland plant ecology. Did I get that right?
You got it.
Cool. Upon her return to Michigan, Amanda was a Michigan Sea Grant Fellow with the Great Lakes Commission. In 2014, she wanted to get out from behind the desk and began working on an organic farm. Her love of food grew as she started working as a chef, allowing to connect with people more directly to the beautiful, locally grown food. More to come on that. David Ripple. David serves as Vice President of Development for St. Joseph Mercy Health System, leading all the fundraising teams and activities within the 5 hospitals in southeastern Michigan. Previous to his role, David served as President of the Remington Group, a good friend of both of ours, Peter Remington, Vice President for Development at The Ohio State University, I have to say it that way, and Wayne State University's Vice President of Development and Alumni Affairs, and President of the Wayne State University Foundation. So that is very impressive, both of you. So, David, I'll start with you. Higher education, so very impressive. You worked at an organization that I became familiar with. Obviously, I was in Toledo at the University of Toledo, University of Akron, and the Ohio State University, and a fundraising machine. It truly is. As well as Wayne State, you did some great things there and raising billions of dollars during your efforts. So I just got to tell you how impressive that is.
Well, thank you, Larry. Thank you.
Yeah, appreciate you being here. So how did those experiences prepare you for what you're doing now?
Well, thank you. First, Larry, let me just say thank you for having Amanda and I here and for the very incredible grant that you gave to help us purchase a tractor for the farm. I know Amanda will talk more about that.
Right. I love that tractor.
No, but I think, Larry, I've been in this fundraising world 26 years, and fundraising is about a couple of things that stand out. Great leaders stand out for me, great teams, and a generous and supportive community. And while I, have enjoyed every experience that has led me to this point, I guess my dad has the expression, you are what you were when. So all the experiences that I've had have brought me to St. Joe's. And when I think of just in the last week, St. Joe's was recognized by the Detroit Free Press as a top place to work.
Right, I saw that.
And led by our president and CEO, Rob Casselu. Great leaders are abundant in our health system. The 5 hospital presidents in Southeast, many of our physicians. We have 14,000 colleagues and 2,700 physicians among the 5 hospitals in our community. And to make the decision to come be part of this health system was an easy one.
Yeah, well, great. Well, they're fortunate to have you. And what we're going to talk about next with Amanda is also impressive that a system is so committed to social determinants of health. I commend you on that, and I think being a trendsetter is all about leadership, and so we're going to talk about that. So, Amanda, hello.
Hi.
Good to see you again. Tell our listeners about your role at Trinity, Michigan, and in the hospitals.
I would love to. So my role has evolved very recently. Up until a couple of months ago, I was the manager of the farm at St. Joe's Hospital, right? Where we grew food, and our mission is to grow a healthy community through food, education, and relationships. And the beautiful thing about the transition of my role to being the director for the state of Michigan is that we now get to live that mission at all of our sites. And that doesn't mean that every hospital site within the system will have a physical farm. Not all of them have the land resources to do so. But we can start to live that mission in other ways, namely thinking about how are we interacting with our community, not just in the episodic care that we give them, which we're really so good at the St. Joe's hospitals, but what's causing people to come in time and time again with high blood pressure and those things. And more often than not, it might be what they eat. Right. And maybe it's not just what they eat, but do they have access to transportation? What about the education in their community? Those things. And so my role is really to work with our community health and well-being department to say, what are we doing to serve our community so that they're healthier long term, and then if they do come to see us, that they're going home sooner, healthier, less likely to be readmitted.
Yeah, so maybe instead of health care, it's health, and wellness. You do a great job when you need to be in the hospital, but it sounds like you're trying to keep people on a path that they don't need the hospital as often.
Yeah, and this is really living Trinity's mission to be a transforming healing presence and a partner for life with our patients and our members. And I think when you think about the start of the farm, Rob Caslew, one of our great leaders, his vision was really to take healthcare out of the hospital. Yeah, and I'm so excited to be able to be living that mission and be the heartbeat of this work in our community.
Great. So before we talk more about that, you need to tell our listeners, and we're talking with Amanda Sweetman, who is the Regional Director of Farming and Healthy Lifestyles for Trinity, Michigan. Tell us about the farm at St. Joe's, because that's how we met, and that's where our grant went. So,
right.
Why does someone might be driving home and says, why does a hospital have a farm?
Why does a hospital have a farm? That's the most common question I get. Because it's not the most obvious connection, but when you think about it, it's a great connection. Mm-hmm. So St. Joe's Ann Arbor has the largest healthcare campus in the country. We have 365 acres. Used to be 3 different family farms. And when we decided that we wanted our hospital to be not just about healthcare in the hospital, but being healthful, we said we need to meet people where they're at, join them on their path toward better health. And what better way to do that than through food? And so the reason we've decided to do this as a farm is that it's a return to our roots. And, a homegrown tomato tastes so much better than when you get from the store.
Yeah, a whole lot better.
So much better. And so if the food tastes better, it's easy to start having a conversation with people about eating food that tastes better, also makes you feel better. And what are those other things we can be doing to help you make those incremental changes to being healthier, living your best life?
Wow. So more on that in a couple of minutes, but I'm going to ask Dave to talk a little bit about what's happening in the hospitals, the 5 hospitals that we talked about. Anything that you want to make sure our listeners who all live, if they're listening to this show, live within your hospital's area. So,
well, thanks, Larry. I think back to your first question about why did I make the choice to join the health system? There's multi-layers, but St. Joseph Mercy Health System and our 5 hospitals are actually we're owned by Trinity Health,
right?
And Trinity Health owns 92 hospitals around the country. So when you think of the depth and breadth that our physicians and our care providers provide to our patients and families and communities, it's significant. We have, Amanda mentioned the hospital in Ann Arbor. We also have one in Pontiac. We have one in Livingston County in Howell with a Brighton Health Center as well. We have one in Livonia, St. Mary, Mercy in Livonia, and we also have one in Chelsea. So we cover a large portion of the Southeast Michigan area, and really that depth and breadth of care that we provide, not just in the hospitals, but our attention and focus on community health and well-being. And, with what Amanda's leading, not just in Southeast Michigan, but also on the west side of the state, is a significant example of our commitment to the community and to growing our outreach as well.
Yeah, well said. So, Amanda, we're very proud of the Children's Foundation's grant to the farm at St. Joe's. So tell our listeners about the grant. We mentioned the tractor.
Yep.
That's my favorite part, but there's a lot of other good parts too.
So the grant is really a great representation of our partnership to care for children in our communities. And so one of the big things was the tractor, which will help us grow a lot more food on campus. I'll have to carry many fewer bins, which will be good for my back. Thank you very much.
Yes.
But the biggest part of that grant was to provide free farm shares to families who are food insecure in our community. The farm share program is a really great program where we bring in food from, it's 12 local farms, including food from our farm, package it up, and then it goes out to families in our community. People can pay to participate, or in this instance, people can receive the program for free. We've seen some really amazing impacts from the program. 84% of children in last year's program asked for fresh fruits and vegetables as a snack.
Oh, that's progress versus potato chips.
Versus potato chips, right? And these kids got to participate in free summer camp if they wanted to. And the farm really becomes their backyard. So they get to say, oh, this week the tomatoes are this tall, this week they're that tall. And it becomes a real community space where we can start to address some of those social determinants of health that you mentioned. Sometimes it's access to fresh fruits and vegetables. Sometimes it's, do you have a strong social network, right? And so last year, again, 94% of our members, both paid and unpaid, said they felt like they were a part of our community at the end of last year. And so it's giving people a place or a person to call and say, my car broke down. What do? I need to be able to get to work. And I can say, okay, good. I know community resources that we can help connect you to.
Yeah, so it's more than just the food and the education of nutrition. Right. It's that socialization and really all of the social determinants of health.
Yeah, and it's really treating somebody as a whole person.
Yeah, terrific. And so if someone were interested in your path, what would your recommendation be? I mentioned your academic background, but farming and things like this seems to be more prevalent now, and with young people, what would you suggest?
Well, I would suggest thinking outside the box to a certain extent. I could never have envisioned that this would be my career. And at some point, I got off the academic track. School, to a certain extent, is good at training you to be in school. And at some point I said, man, I really just want to get skills. And so I started taking jobs and volunteering, and I was a wedding planner, and I was a caterer, and I cared for cattle, and I've done a lot of different really interesting things that gave me various skills. And I started to really just get to know my community, and that's, I think, been one of the biggest things, is being willing to make relationships, introduce yourself to new people, think about what is it that you like to do? And for young people, I think the biggest piece of advice I can give is not to be afraid of reaching out to someone you admire.
Yeah, and trying different things. Obviously, you've done a lot. Yep. So great advice. So Dave, as it relates to the hospitals that you're involved in and social determinants of health, as well as inpatient care, where do you see these efforts sort of going, both of you, either Dave or Amanda, in the next 5 years or so?
Well, I think from the lens that I look through on a daily basis in terms of philanthropy, I think there's obviously more and more, especially on the foundation side, but corporate and individuals as well, there's an interest in this kind of work because it's broader and it's helping a larger portion of the community. You know, in our history, our health system has raised almost $350 million, which is a significant amount. But I also think that the opportunity that exists, especially as it relates to programs like the farm, it gives people the opportunity to think of philanthropy in a different way and really see it and touch it and feel it. And I think that's going to be helpful to us in the long term.
Yeah, that's very timely. Last week, I participated in a healthcare summit with maybe 10 other, maybe 15 development fundraisers from big systems like Trinity. And that topic came up. Can we raise money for things that are not in the hospital? And the overwhelming answer was yes. People, philanthropists and everyday people are now ready to support things that are keeping them well, not just supporting a piece of equipment in the hospital, which, as we know, is traditional. And I think you guys are ahead of the game. But it's something that, as you know, the Children's Foundation, supporting you, and now 76 other organizations. We don't provide any service ourselves like your hospitals do. So these kind of partnerships are not only our present activities, but it clearly is our future, doing more with the likes of Amanda and you, Dave, and in social determinants and really trying to keep people, get them healthy and have them stay healthy. So this partnership we started is not going to end. I hope you know that.
Thank you. Are we recording this?
Yeah. Indeed we are.
Okay.
So Amanda, anything else you want to say to our listeners before we let you go?
Well, I think just keep an eye out for how we're continuing to grow. We have a new hospital-based farm starting at our hospital at St. Joe's Oakland, so in Pontiac.
Oh, okay.
We just got started on Halloween. We planted 450 daffodils, got our cover crop all established. So we're painting the vision of what that's going to look like. And just to stay in touch, we have a lot of different ways to engage with us, and we're excited to continue our partnership.
Great. Well, I will be visiting again next season because you gave me a nice care package when I left of some great fresh vegetables. So thank you, Dave.
Thank
you, Amanda. That's Dave Ripple and Amanda Sweetman from our partner at St. Joe's Hospital and Trinity Health. So next, we're going to hear from Loretta Bush. She's with Authority Health, and that's when Caring for Kids continues right here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Foundation. Once again, here's Larry Burns.
Joining me now is Loretta Bush. Loretta has been a leader in the health and human service field for over 35 years and currently is president and chief executive officer of Authority Health. Prior to this role, Loretta served as the public health officer for the city of Detroit and Wayne County, then as president and CEO of the Michigan Primary Care Association. Loretta received her bachelor's degree from the University of Michigan and her master's in health services administration from Central Michigan University, which is my alma mater. Fire up chips. So, Loretta, welcome to Caring for Kids.
All right. Thank you, Larry. It's a pleasure to be here.
It's good to hear your voice. We recently had a nice breakfast at Louie's on Mack Avenue. I have to plug that. And had a nice chance to get to know you. And that's when I knew that you would be a great guest for Caring for Kids.
And I've been looking forward to it ever since, and that was my first time at Louie's, and it won't be my last.
Yes, it's very, very good, both for breakfast and for lunch. So your experience that I mentioned in Detroit with the city and Wayne County, how has that impacted your ability to serve your new role? What did you bring from those experiences to your new position?
Yeah, well, in all of the previous roles, there was like a serious focus and a love of children, knowing that they're the future, but also knowing that many of the health problems that we face today, we really have to go upstream if we're going to impact on them. So when I say go upstream, I mean if we're looking at things like adult obesity, we're talking about, teaching kids to have a variety of food choices, and that food is for fuel and that we burn it, not store it. So, physical exercise through play and things like that. Also, just impacting the lives of people early really is what's going to make a difference. So working in public health with all of the focus on things like childhood immunization and WIC, and working with people from the preventative vein really helps me in this position, especially because we have the residency program, which is training our doctors of the future. And so when we can impact on them early in their career to look at things like the social determinants of health and preventative medicine, it's just an exciting next phase of my career, and hopefully that those past experiences really will bring a lot to bear in this new position.
Well, well said, by the way, and we're talking with Loretta Bush from Authority Health. No doubt that your experience will help you because of what you just said about being in the communities. Social determinants of health, why people might be obese as a child will impact their health as an adult. So no doubt the things you learned in your previous roles are going to help you in your current role. So Authority Health is a very strategic organization. They were one of our very first partners a few years ago as we expanded our role into the community. But I want our listeners to know a little bit more about Authority Health and the way you deliver primary care in neighborhoods. Can you talk a little bit about that?
Absolutely. So we are very fortunate to be the second largest graduate medical education teaching health center in the country. We have 71 residents that rotate in primary care, in family health, in internal medicine, in pediatrics, and in psychiatry. The difference between us and other residency programs is that we do rotate throughout the community. Other residency programs are pretty much hospital-based or stay in one location. But we have over 51 partners throughout the community. So the residents that we attract are residents that want to work in underserved areas and really want to understand the needs of the individuals that come into FQHCs, into private practices that are embedded in the community. And many times these are resource-constrained communities.
Right. Where transportation would be a reason they don't go to a facility if it's too far, correct?
That's exactly right. So for us to be able to rotate in health centers that are embedded in the community is ultra important.
And so one of the things that I mentioned that Authority Health was one of our first community-based partners as we expanded a few years ago. But we have a new partnership with a new grant as it relates to what you're doing in a very innovative way. And so can you tell our listeners about that?
Absolutely. And Larry, first let me just say that we are so thankful for your first support and your continued support. And with this is trauma-informed care and training for our residents.
Yeah, very important.
And what they saw over time as they were doing their community rotations in various different community-based organizations, they observed that there was one social determinant that was common in many of their experiences, and that was extensive exposure of children and families to trauma.
Yes. Yep.
And so to have them trained in trauma-informed care so that they are able to use that in the diagnosis and the treatment going forward, and making sure that they don't further traumatize by either not knowing of the trauma or knowing of it but not knowing how to work that into the therapeutic environment. This has really will really take our residency program to the next level, but also will prepare the physicians of the future.
Yeah, no doubt, and that was an idea that your team came up with, and it really actually excited our grant people and trying to impact, because we hear so much about trauma and what, as you know, they refer to as ACEs, which is a way to measure how much trauma a youngster has had in their young life. And to be able to train residents, these are young doctors for the most part, that are starting their career, that have chosen to be in a community, and for our foundation to have some impact on their training is so very important to us.
I couldn't have said it better. And, this is something that will live on into the future because, for the most part, these are young physicians just about to start their practice. And unless something, happens, they will be practicing for many years to come, utilizing what they have learned in this training, and probably also impacting other physicians that come along the way behind them. Many of our residents are very much committed to continuing their practice in underserved areas. So this is something that is very important now, is sustainable, and can go on into the future. And it goes upstream, right?
Yeah, so that goes upstream.
It's not just for today, which is very important, but it also will impact the future.
Sure, absolutely. So anything else you want our listeners to know about Authority Health before we let you go?
Well, I will just mention that in addition to our residency program, we also did acquire the Popoff Family Health Center on the east side of Detroit.
Mack Avenue.
10809 Mack Avenue.
Loretta, thank you very much for all you're doing. Congratulations on your position, and I look forward to being a partner of yours for many years to come.
Thank you so much, Larry. We look forward to it, too.
All righty. Onward, as we like to say.
Onward.
Yeah. That was Loretta Bush of Authority Health. And coming up next, I'm going to introduce you to this month's Little Champion and also provide you some update on some foundation news. And that's coming up right here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Great show tonight with our guests, and one of my favorite parts of the show is this one, the Little Champion feature. The Little Champion program honors children who have overcome major obstacles in their young lives and continue to tackle those challenges with a smile each and every day. Meet this month's Little Champion, 6-year-old Kai. When Kai was 5 months old, he was found in a park in China and sent to an orphanage. There it was discovered that he had a rare genetic disorder. Even in the midst of all this, Kai has overcome his obstacles and is doing great. Adoption changed his life and provided the necessary medical needs for him to thrive. Congratulations, Kai, as this month's Little Champion. And for more information on the Little Champion program and how you can nominate a child, visit yourchildrensfoundation.org/champion. Couple foundation updates. Join us on December 8th from 6:30 to 8:30 at Tory Perch in the Somerset Collection for an opportunity to shop while supporting a great cause. That's the Children's Foundation. Then also the 8th annual Cheers for Children will take place on Saturday, January 25th at the very cool State Savings Bank in Detroit. That supports the Children's Foundation as well. Thanks for joining us on Caring for Kids. We hope to see you next month.
Caring for Kids with Larry Burns on WJR has been presented by the Children's Foundation.